Hello, APA colleagues. So I was told that I would need to locate at least one gray hair in my head in order to properly accept the 2020 APA Award for Distinguished Contributions to Independent Practice. Well, I'm not sure if I was successful, but I'd like to humbly accept the award anyway. And I'd also like to invite you all to spend the next half hour with me as I share my address with the APA membership. In all seriousness, though, I think many of us are just a little bit grayer as we strive to meet the evolving and complex needs of our patients during COVID, which makes this honor at this particular time that much more poignant and meaningful. For those of you who don't know me, I'm Dr. Adam Weissman, and I'm the founding president, CEO, and chief psychologist of the Child and Family Institute, or CFI, and Weissman Behavioral Health, two evidence-based mental and behavioral healthcare organizations, as well as CFI Academy, a series of progressive online education schools and support services, and my newest passion project in development that I'd like to formally introduce today by way of this address, the Weissman Children's Foundation. In early January, I woke up from a dream and told my wife, Annie, that I wanted to start a nonprofit organization bringing evidence-based mental health treatments to all children and families in need. Of course, Annie thought I was crazy as we were currently on leave and caring for our newborn baby boy, Skylar. But once the wheels started turning, plans for an organization with the potential to help change the mental health landscape in our country began to take form in my mind. Serendipitously, a week later, I learned that I would be the recipient of this prestigious Distinguished Contributions Award, which was surprising and humbling news for a new husband and father, still imagining the meaningful impact and legacy that my generation might contribute. To me, this was karma. Being honored by my peers in a special way only validated and strengthened my resolve to use this opportunity to dedicate this next chapter of my life to revolutionizing the mental health field by creating broad-based access to evidence-based treatments, or EBTs, with a keen eye toward racial and social justice through the lens of reducing mental health disparities. The Weissman Children's Foundation, or WCF, is a national nonprofit organization dedicated to the large-scale training and implementation of evidence-based mental health services for children, families, parents, and young adults. WCF, in partnership with the Child and Family Institute, has 15 sites across 7 states throughout the US and a global telehealth initiative. WCF's mission is to raise the standard of care and access the best practices for youth by offering gold standard psychological treatments to every child and family in need, regardless of the family's ability to pay. To state what most of us know, and the premise behind WCF, the overwhelming majority of specialized evidence-based mental and behavioral health services in the United States are almost exclusively accessible at expensive out-of-pocket private clinics. In addition, the federal government and the insurance companies have not adequately prioritized coverage for these services. In fact, it has been over a decade since Congress first passed the Mental Health Parity and Addiction Equity Act, with its promise to make mental health treatment just as easy to access as other medical services. Yet today, amid a global pandemic and economic crisis, an opioid epidemic, and spike in suicide rates, patients are still struggling to access quality mental health treatments. In fact, a recent study by Milliman, a risk management and healthcare consulting company, reported that mental and behavioral health services were 4 to 6 times more likely to be provided out of network compared with medical or surgical care. The study also revealed that in-network mental health providers were paid significantly less, in some states more than 50% less than primary care providers offering similar mental health services. Because of these low reimbursement rates, highly skilled or specialized mental health providers are incentivized to work out of network for private pay and avoid in-network insurance contracts. The study reported as high as 63% of behavioral health care occurring exclusively out of network in some regions, for example, Washington, D.C., resulting in expensive insurance plans with insufficient mental and behavioral health networks, coupled with rising costs of expensive private out-of-network services. NPR recently profiled a 28-year-old woman who struggled with borderline personality disorder and addiction. She saw her therapist every week with a $25 per session copay. But in 2015, the therapist stopped accepting her insurance and her rate jumped up to $110 per session. The patient called around to about 10 other providers, but couldn't find anyone who would accept her insurance and was taking new patients. She's quoted saying, "It's such a daunting experience for someone who has trouble maintaining their home and holding a job and friendships. It makes me feel like no one can help me and that I'm not good enough and that it's not an attainable goal. I make $30,000 a year. I can't afford an out-of-pocket therapist or psychiatrist. I just can't afford it. I'm choosing groceries over a therapist." Of course, there are millions of Americans just like this young woman left without access to affordable, quality mental health care, which is further compounding significant mental health disparities among socioeconomically disadvantaged and BIPOC or racially diverse populations. During the concurrent crises touching on public health, mental health, racial and social justice, and economic recovery, it is more important than ever to increase accessibility of affordable and pro bono evidence-based care for underserved children, families, and communities in need. Fixing the systemic problem of access to affordable care can't wait for a long-term solution. The problems for families are ongoing, but accelerated dramatically by the global pandemic. We must address this now. While still in formation, WCF has launched a comprehensive mental health COVID-19 relief initiative, offering state-of-the-art programs and services exclusively via telehealth. As with the Child and Family Institute, Weissman Behavioral Health, and CFI Academy, WCF uses an innovative clinical practice dissemination and implementation model, which my team and I published earlier this year. The model integrates 5 core unifying initiatives. Number 1, dissemination through training. Number 2, dissemination through community partnership. Number 3, dissemination through interdisciplinary behavioral health. Number 4, dissemination through multi-site program development. And number 5, dissemination through technology, all with a common goal of raising awareness and leveraging local and national partnerships and resources. First, our dissemination through training initiative trains student clinicians in EBTs for youth emotional, behavior, attention, and habit disorders to increase the number of evidence-based providers pursuing licensure, as well as the provision of low-fee and no-fee services to underserved communities during COVID and beyond. To accomplish this, we first offered clinical psychology and social work training programs in-house at CFI and WCF. We used a modular cognitive behavioral therapy approach that included protocols for anxiety, depression, eating disorders, trauma, selective mutism, OCD, tic and habit disorders, ADHD, parenting and behavioral challenges, and the full array of youth psychiatric disorders and related issues. In time, CFI and WCF trainees receive funding for external EBT training opportunities through our scholarship training initiative, which provides stipends to attend virtual conferences and workshops on cutting-edge practices. In turn, our trainees then present updates back to the group. Currently, we are developing external collaborations with local training programs to provide expert EBT dissemination through training. Our goal is to scale further access to high-quality care through a growing collective of pro bono and low-fee student clinics. Our first partnership is with Columbia University Teachers College Student Clinic, servicing Harlem, the Bronx, and other highly COVID-afflicted, under-resourced communities. Indeed, several of our trainees have now gone on to start their own clinical practice and training institutes throughout the country, furthering our mission of EBT dissemination through training. Secondly, our community partnership initiative promotes outreach, consultation, advocacy, and education and engagement around EBTs. CFI and WCF staff present and consult frequently to schools, parents, clinicians, and community organizations around the US. And recent WCF speakers and collaborators have included nationally and internationally renowned psychologists, Drs. Bob Leahy, Cheryl McNeil, Phil Kendall, John Weiss, Leslie Sokol, Dennis Turch, Amy Kashpa, Shannon Welty-Sturman, Ray DiGiuseppe, Denelia Rosa, and Dean McKay, and many more. And our initiative directors reside on city, county, state, and national CBT and Psychological Association governance boards, forging collaborative efforts in local crisis relief initiatives co-hosting community-wide events, and advocating for best practices with youth from both a clinical and public policy standpoint. Finally, we are in the process of launching a COVID relief partnership with local schools and school districts to increase broad-based direct EBT access to youth during the pandemic and beyond. Our third initiative is developing local partnerships among expert evidence-based providers across a wide range of behavioral health disciplines. We hope to foster an integrated virtual behavioral health collective, promoting best practices for youth not only within the field of clinical psychology, but also pediatrics, psychiatry, neuropsychology, occupational therapy, speech therapy, holistic health and nutrition, social work, and special education. And in doing so, WCF's two-pronged goal is to, one, create an ongoing dialogue with and educate one another about evidence-based therapies and services, and two, provide more integrated behavioral health programming and coordinated care for families requiring multiple ongoing services. Fourth, a multi-state, multi-site program development initiative is now underway to promote greater geographic EBT dissemination and implementation. To accomplish this, we are collaborating with local practitioners, organizations, and policymakers in dozens of communities across the country to assess the mental health landscape, barriers to EBTs, and the impact of COVID for the full range of youth mental health conditions. To date, we have developed 15 sites across 7 states, including our headquarters in Westchester County, as well as Manhattan, Brooklyn, and Long Island in New York, and in New Jersey, Connecticut, Pennsylvania, Florida, Michigan, and California, all operating virtually during the pandemic, with prospective plans on the horizon to service Washington, D.C., Washington State, and Alaska. We work with each community to develop programs that serve the unique mental health needs of those communities. Examples include the Brave Voices Selective Mutism Program, our Center for Chronic Medical Conditions, an Adoption, Attachment, and Complex Trauma Service, and our Virtual Reality Therapy and Biofeedback Program in communities where no such services previously existed. Our fifth and final Dissemination Through Technology, or DTech initiative, leverages innovative technologies and tracking systems to assess treatment effectiveness and fidelity in real-world practice, and models for EBT service delivery, program evaluation, and implementation. First, our DTech initiative utilizes technology-based alternative and supplemental EBTs to optimize hard-to-access symptoms and treatment content. For example, we may integrate virtual reality technology for difficult-to-treat anxiety disorders, particularly while families are in social isolation due to COVID and are unable to access and engage in typical EBT protocols like exposure therapy for social anxiety, phobias, OCD, and trauma that may routinely occur in a public forum. When working with patients on-site, we frequently pair our virtual reality therapies with biofeedback as well to collect psychophysiological data on symptomatology and mechanisms of therapeutic change. In addition, DTech features a strategic partnership with My Best Practice, a new electronic health record specializing in evidence-based treatment tracking, data collection, and program evaluation, including global assessment of treatment outcomes. The goal is to scale effectiveness research, funding, and site development efforts, and broaden overall access to treatments that work. The partnership between WCF and My Best Practice is also ripe with potential for a prolific research collaborative studying treatment fidelity and effectiveness in real-world community settings, mental health and mental health treatment disparities with an eye toward racial and social justice reform, as well as national service delivery and implementation models for underserved communities during COVID-19 and beyond. Perhaps most crucial to the Weissman Children's Foundation's 5 core initiatives is the accessibility and affordability of services for each and every child, regardless of the ability to pay. This includes completely free, evidence-based care for uninsured and underinsured families, breaking down nationwide, generations-old barriers to EBT access in our most disadvantaged, marginalized, and often highest needs communities. This guiding vision is more essential now than ever, with so many families in economic and mental health crisis throughout the US and around the world. With teletherapy services underway and nearly 100 children and families in need already receiving support from our COVID relief initiative, we are delighted that preliminary anecdotal feedback from those we serve has been both positive and heartwarming. As an example, one recent WCF family, referred to us by another family we helped, was in urgent need of a therapist for two sons who had witnessed domestic violence, substance abuse, and a highly contentious divorce. Both of these young boys were experiencing diverse and complex trauma symptoms exacerbated by the mounting stress of COVID. After shopping around for specialized trauma services, the parents were convinced that they could only afford to have one son in treatment, and they were agonizing over a Sophie's choice of which son to help. At WCF, we obviated that choice by helping both brothers pro bono, assigning each child to their own expert trauma-focused CBT clinician, and who also specialized in behavioral parent training with high conflict families. And this provided both parents with the tools to create a more stable home environment and collaboratively support both boys in working through their traumas. In addition, at a recent WCF meeting, one of our clinicians shared progress on 5 BIPOC children whose parents had been experiencing significant COVID-related financial distress and job loss. The increased stress at home was exacerbating pre-existing PTSD symptoms in the children, some of whom had experienced further trauma from deaths in the family due to COVID. The clinician was able to provide expert cognitive behavioral therapy for co-occurring anxiety, depression, trauma, grief, and behavioral issues, successfully reducing symptoms of distress and preparing them to cope with future potential COVID-related traumas. At WCF, it's been incredibly rewarding to create life-changing support and programming for these and many other underserved families and communities in need right out of the gate. We continue to set new goals for ourselves as we've been fortunate to reach many more children and families and scale our programming much more quickly than we initially anticipated, all thanks to the hard work, creativity, and collaboration of our dedicated and talented team of staff and volunteers. I'd like to end by thanking some very special people, both personally and professionally. First and foremost, thank you to my many mentors along the way, including Dr. Melissa Hunt, my undergraduate advisor at the University of Pennsylvania, Drs. Brian Chu, Linda Reddy, and Jan Molman, my graduate mentors and collaborators at Rutgers University, as well as my many externship and internship supervisors at the NYU Child Study Center and Bellevue Hospital Center. And finally, Dr. John Weiss, my postdoc mentor at Harvard University, who ignited my passion for broad-based EBT training and implementation work with underserved youth. Many of these former mentors and supervisors I now have the privilege of calling co-authors, collaborators, and friends. And finally, I would be remiss if I did not properly thank my beloved and trusted colleagues at the Child and Family Institute and our 3 partner organizations, including Drs. Emily Becker-Weidman and Michelle Barton, who nominated me for this award, as well as my dear friends at APA, the Association for Behavioral and Cognitive Therapies, the New York City Cognitive Behavioral Therapy Association, the New York State Psychological Association, and the Westchester County Psychological Association. Your friendship, collaboration, and support over the years has been energizing and deeply meaningful. I am truly blessed to love what I do and to have all of you in my life, both to learn from and to share challenges, successes, and good humor with. In the personal realm, thank you to all of my friends and family for your positive spirit, love, and encouragement. And a special thank you to my parents, Ronnie and Eugene, and my sister, Alon, who have been there every step of the way with endless love and support. Finally, to my loving wife, Annie, and my baby boy, Skylar, you challenge me every day to be the best husband, father, and man I can be. You are my inspiration, and I love you. And last but not least, a very special thanks to all of you for joining me today during these unusually difficult times to share this honor with me and my community. I'm sending my love and my very best wishes to you and your families for a safe and healthy summer and healing thoughts to the world.